Explain the technique that you use.
All right, Heidi. We do a technique which is called the SuperPath technique. It's actually a combination of two separate techniques. It's a much less invasive way of doing a traditional total hip replacement. We can do it in much smaller incisions, but the main thing is we don't ever actually have to dislocate the hip when we're doing the surgery, so the recovery for our patients is a lot faster.
Did I also read that you can do this outpatient?
Yeah, that's absolutely correct. We've been doing outpatient total hip replacements. People come in the morning, and if they're early enough, we actually can go home the same day of surgery. Some will stay overnight too, but yeah, a lot of times people can go home the day after surgery.
That's impressive. Now, I know you said the recovery time's a little shorter. Is the recovery still the same? You still need kind of the same therapy?
Not really. Some of the traditional precautions that are required after hip replacement surgery are really not necessary after this procedure, correct. So people can drive and do activities of daily living much faster, putting on socks, simple tasks which may sound simple but are inconvenient if you cannot do those immediately after surgery. And with this technique, you definitely can.
Now, is anyone who needs a hip replacement a candidate for this type of surgery, or are you looking for special people?
No, basically anybody who has hip arthritis, who's bad enough to need a hip replacement, can have the hip replacement, have the SuperPath technique. We don't pick and choose. Basically, I've been doing it on 100% of my patients ever since I started doing it in about 2013.
Wow, and is this a hip that's going to last them the rest of their life?
That's a good question. We really do use traditional hip implants for this procedure. There's nothing different than what's out there. Of course, we use what we think is the latest and greatest.
All right, well, thank you guys. You can find more information about both doctors and the SuperPath technique at superpathstl.com.